Our topic of discussion is orbit. What are the contents of the orbit? And then we are going to study about the muscles in relation to the eye, that are the extraocular and the intraocular muscles. So first of all, we must have to know what are the contents of the orbit. So please remember, this question can ask in your anatomy examinations. So what are the contents of the orbit? So number one, the contents of the orbit is the eyeball itself. It occupies anterior 1/3 of the orbit. Second, it contains fascia. As you can see in the diagram, there is an orbital fascia and there is a bulbar fascia. Okay, so this one which I am highlighting in blue color, this is the orbital fascia. Okay, so this is your orbital fascia, and this fascia which I am highlighting in red color, that is the bulbar fascia. Okay, so two fascias in relation to the orbit, that is the orbital fascia and the bulbar fascia. Okay, number three, the contents of the orbit, these are the muscles. So it can be extraocular muscles and it can be the intraocular muscles. Okay, extraocular and intraocular muscles. Then there are some vessels present here, that is your ophthalmic artery, superior and inferior ophthalmic veins, and the lymphatics also. Okay, lymphatics. And very important thing, the nerves which are in relation to the orbit. Okay, so it is your optic nerve, that is your second cranial nerve, the oculomotor nerve, third cranial nerve, trochlear nerve, abductor nerve. Okay, so all these cranial nerves, abductor nerve, and the branches of the ophthalmic nerve, the maxillary nerve, and the sympathetic nerves, all these are in relation to the orbit. Then next thing which is present in the orbit, that is the lacrimal gland. Okay, lacrimal gland, and then last thing, it is the fat. So these are the contents of the orbit. So what are the contents of the orbit? That is the eyeball, the fascia, okay, the fascia, the muscles, the blood vessels, nerves, and lacrimal gland, and orbital and fascia. Okay, now first thing which must have to remember, some important points in relation to the fascia. As you can see in this diagram, this is our orbital fascia now. So please remember, this orbital fascia, it is you can say it forms the periosteum of the bony orbit. Okay, so periosteum of the bony orbit, that is the orbital fascia. Posteriorly it is continuous with the dura mater. So posteriorly it is continuous with the dura mater and with the optic nerve sheath. So this is your optic nerve. So posteriorly it is continuous with the optic nerve sheath. Anteriorly, please remember, it is you can say continuous with the periosteum, lying the bones around the orbital margin. Okay, now some important point which you must have to remember in relation to the orbital fascia. Number one, very important point, that the orbital fascia is forming upper, see here, this upper and lower margins of the orbit. The fascia sends off a flap-like continuation. So this flap-like continuation, it is known as orbital septum. Okay, so these extensions of the orbital fascia, that is known as what? That is known as orbital septum. Okay, and one more thing, please remember that this fascia, this orbital fascia, very important thing, I will show you later in the diagram, that this orbital fascia, it holds a fibrous pulley-like tendon of the superior oblique muscle. Okay, that is known as trochlea. Okay, so that fibrous pulley-like tendon which is holding the superior oblique muscle, it is also formed by the orbital fascia, and it is also going to form the lacrimal fascia also. Okay, so these are the important points in relation to the orbital fascia you must have to remember. Second thing which you must have to remember, that is the facial sheet of the eyeball or the bulbar fascia, which I show in this diagram in the red color. This is the facial sheet of the eyeball, or also known as bulbar fascia. Now please remember, in relation to the bulbar fascia, when it is covering the eyeball, it is known as, now if I write here the bulbar fascia, please remember it is known as Tennant's capsule. I will show you the diagram. Okay. So what is Tennant's capsule? It forms a thin, loose, membranous sheet around the eyeball. A thin, loose membranous sheet around the eyeball is known as Tennant's capsule, and it is separated. You can say, so eyeball can freely move within this sheet. Okay, and here there is also a space present between the eyeball and this Tennant's capsule, that is known as episcleral space. That is known as what? Episcleral space. Okay, so this sheet also gives off some extensions. Number one, it covers the each orbitalis muscle. Okay, it covers your what? Each orbitalis muscle. This is your orbitalis muscle. Okay, this is the orbitalis muscle. So it is covering the each orbitalis muscles. Next important thing, it is also forming the medial check ligaments. Okay, it is also your forming the medial check ligaments, and this medial check ligament, and it is also forming a lateral check ligament also. I will show you the diagram. Okay, so it is forming the medial check ligaments and the lateral check ligaments, and the lower part of the Tennant's capsule. Please remember that lower part of the Tennant capsule, it is thickened, and it is named as the suspensory ligament of the eye. Okay, it is known as what? Suspensory ligament of the eye, or it is also known as suspensory ligament of Lockwood, according to author name. Okay, so I show you the diagram. See here, all students. Now see this picture first of all. Okay, so this is the orbital fascia, which I am highlighting in blue color. This orbital fascia is now covering the lacrimal sac, so this is known as lacrimal fascia. Okay, this is this one which I am highlighting now in red color, that is your what? That is your bulbar fascia. Okay, and this bulbar fascia covering the eyeball, and this space this is known as episcleral space. Okay, and these extensions are known as lateral check ligaments and medial check ligaments. Okay, lateral check ligaments and medial check ligaments, they are the expansions of this sheet. Okay, they are the expansion of these sheets. Now see this diagram. Now see here, this is your which fascia? This is your bulbar fascia, and when it is covering the eyeball, this is known as Tennant's capsule. Between the eyeball and the Tennant's capsule, see here, between the eyeball and the Tennant capsule, this space is known as episcleral space. And now it is forming here the lateral check ligament and the medial check ligament. Lower part of the Tennant's ligament, it is thickened, and it is now forming the suspensory ligament of the eye, or also known as suspensory ligament of the Lockwood. Okay, so it is expanded in the center and narrow at 6 extremities. It also having these muscles of the eyeball. Okay, so it is formed by the union of the margins of the sheet of the inferior rectus and inferior oblique muscle also, आप ऐसे भी बोल सकते हैं. Okay, so this is the fascias in relation to the eye orbit. Okay, now we must have to know what are the borders of the orbit. So please remember, whenever you are writing the borders of the orbit, please remember number one thing. Roof is formed by the frontal bone and the lesser wing of sphenoid bone. Number one thing. Second, lateral wall. It is formed by the zygomatic bone and greater wing of sphenoid bone. Third point, medial border. So medial border, many structures are there. Maxilla is forming, lacrimal bone is forming, ethmoid bone is forming, and the body of the sphenoid is also participating in the medial wall of the orbit. Okay, now the floor is formed mainly by the maxilla bone, okay, which separates the orbital cavity from the maxillary sinus. Okay, so these are the, you can say, the boundaries of the orbit. Okay, so these boundaries of the orbit are very important. Now what are the openings into the orbit? So which openings you must have to remember? Number one, the orbital opening. Okay, about 1/3 eye is exposed, remainder is protected by the walls of the orbit, so that is the orbital opening. Okay, then you have the supraorbital notch or foramen, through which your supraorbital nerve and blood vessels are passing. तो इसमें कोई मुश्किल नहीं है. फिर है आपका infraorbital foramen. Name is infraorbital foramen, so infraorbital nerve and blood vessels are passing. Infraorbital nerve, it is a continuation of your maxillary nerve. Please remember, this is your MCQ. Infraorbital nerve, it is a continuation of your maxillary nerve. This is your MCQ. Then you have nasolacrimal canal on the medial wall. Nasolacrimal canal. Then you have infraorbital fissure, supraorbital fissure, okay, and optic canal. They are very, very important structures. Okay, infraorbital fissure, please remember, it transmits the maxillary nerve, zygomatic branches, okay, sympathetic nerves, okay, inferior ophthalmic veins, these are passing. Superior orbital fissure, very, very important. Okay, please remember, it lies between the greater wing and lesser wing of sphenoid bone. So between the greater wing and lesser wing of sphenoid bone, your superior orbital fissure is forming. Okay, and through which passing various nerves, oculomotor nerve. Okay, superior orbital fissure, you must have to know oculomotor nerve, trochlear nerve, abducens nerve, sixth cranial nerve. Okay, oculomotor nerve, both divisions, superior, inferior divisions. Okay, then your ophthalmic nerve branches. Okay, for example, lacrimal nerve, frontal nerve. Okay, we will show all these diagrams. I will show you all these nerves in the diagram. Nasociliary nerve. Okay, all are passing through the superior orbital. through optic canal. Two structures very important. Optic nerve is passing, that is your second cranial nerve, plus ophthalmic artery is passing. Ophthalmic artery is passing. Okay, so it transmits optic canal, it transmits optic nerve and ophthalmic artery. Ophthalmic artery, please remember, it is the branch of your internal carotid artery. This is also your MCQ. Ophthalmic artery, which is giving blood supply to the eyeball, that is your branch of your internal carotid artery. Okay, so internal carotid artery branch, that is the ophthalmic artery, that is giving blood supply to your eye muscle, to the eye. Okay, so this is also important. So now see this diagram. This is the orbit, this is the, you can say here your eyeball is present. Okay, and now see here in this diagram, this is the superior orbital fissure, the optic canal, the infraorbital foramen. This is the infraorbital foramen through which the infraorbital nerves are passing. Supraorbital foramen through which the supraorbital nerves are passing. So all these structures are very, very important. See here, this is the superior orbital fissure. Superior orbital fissure. Okay, this is the optic canal. This one, this is the optic canal through which your second cranial nerve, optic nerve, is passing along with the ophthalmic artery. Ophthalmic artery, which is a branch of your internal carotid artery. Very, very important MCQ, you must have to remember. So ophthalmic artery, it is a branch of internal carotid artery. And please remember, here I will tell you that ophthalmic artery is giving the branches which are giving blood supply to the eye and the eyeball. That is number one, the central artery of the retina. Number two, ciliary arteries. Number three, lacrimal arteries. And number four, supratracheal and supraorbital arteries, which are also giving blood supply to the skin of the forehead also, plus some muscular branches also. Muscular branches. So blood supply to the orbit, that is given by the ophthalmic artery, which is a branch of internal carotid artery. Please remember it. And the branches are the central artery of the retina. Please remember this central artery of retina, it is an end artery. Okay, it is an end artery. It runs in the substance of the optic nerve and enters the eyeball at the center of the optic disc, and then it divides into branches, and then you can see these branches by using the ophthalmoscopes also. But these branches are your end arteries. Please remember it, very, very important. These are your end arteries. Okay, so central artery of the retina, it is an end artery and it does not have any anastomosis. That's why if there is occlusion of this artery, will lead to blindness in the patient. Okay, occlusion of this artery will lead to the blindness in the patient. Okay, now we must have to see some other important muscles of the eyeball. Now please remember, before studying the muscles of the eyeball, first of all I will ask you some important points in relation to the muscles of the eyeball. Number one thing, see this diagram. So muscles of the eyeball. Okay, now some one important point, see here in the diagram, you have 4 recti muscles. That is your superior rectus muscle, inferior rectus muscle, medial rectus muscle, and your lateral rectus muscle. Okay, so 4 recti muscles. As you can see in this diagram, 4 recti muscles and 2 oblique muscles. Superior oblique muscle and inferior oblique muscle. Okay, so see this diagram. This is the pulley formed by the orbital fascia. This is known as trochlea. That why superior oblique muscle, it is innervated by the trochlear nerve. यहाँ से उसका नाम है. This is trochlear nerve. So SO4, superior oblique, innervated by your fourth cranial nerve, that is the trochlear nerve. Okay, then lateral rectus, LR6, it is innervated by the abducens nerve because it causes abduction of the eye. Abducens, and all the other muscles of the eye, superior, inferior rectus, inferior oblique, medial rectus, okay, superior rectus, all are innervated by what? Oculomotor nerve. Oculomotor nerve. So mnemonic is SO4, LR6, and rest all are innervated by your what? Your third cranial nerve, that is the oculomotor nerve. Clear to everyone? So SO4, LR6, rest all are innervated by your what? Your oculomotor nerve. So some of the important points in relation to these recti muscles. First important thing, all these recti muscles arise from a common tendinous ring of Zinn. This is very, very important. So all arise from a common tendinous ring of Zinn, and then they are inserted into the sclera of the eye, as you can see in this diagram. See, here it is inserting, here it is inserting. So it is inserting into the sclera of the eye. So all the four recti are arising from a common tendinous ring. That common tendinous ring is known as what? Common tendinous ring of Zinn. So origin of the four recti muscle is the common tendinous ring of the Zinn, and they are inserted where? Into the sclera of the eye. Here one MCQ, please remember all students. Where you will find the thinnest sclera. So the thinnest sclera is where the recti muscles are, inserted. Just behind is the thinnest sclera. This is your MCQ. Okay, this is your MCQ. So this is the thinnest sclera where the recti muscles are inserting, that is the thinnest sclera. Just behind that insertion, that is the thinnest sclera. Okay, now we must have to draw one diagram here, because we must have to understand all the muscles and their actions, okay, and other things. So first of all, we will draw here one diagram, and then we will continue with the muscles action also. So see here all the students. So if I draw here the cranial fossa, okay, so this is our anterior cranial fossa, middle cranial fossa. Here you have a very large foramen magnum. So this is your posterior cranial fossa. Okay, now see here, very important, this is your orbit. Now this is the orbit, this is the orbit. Now in the center here, on the, you have the body of the sphenoid bone, and here you have one gland is present, that is your pituitary gland. Okay, so in the middle cranial fossa you have the sella turcica, and your pituitary gland is located here at the body of the sphenoid bone. So this is the place of your pituitary gland. Okay, now here please remember all students, this is your superior orbital fissure, like this. So this is your what? superior orbital fissure. Superior orbital fissure. This is your lesser wing of sphenoid bone. This is the greater wing of sphenoid bone. So if anyone is going to ask you where the superior orbital fissure is forming, it is forming between the lesser wing of sphenoid bone and the greater wing of the sphenoid bone. Okay. Now see here all students. Here you have the tendinous ring of Zinn. This is the tendinous ring of Zinn. In this tendinous ring of Zinn, you have the insertion of your recti muscles. Superior rectus, inferior rectus, medial rectus, lateral rectus. For example, lateral rectus, it is inserting here into the sclera of the eye. So this portion, this one, just behind the insertion of the muscle, this is the thinnest part of the sclera. Thinnest part of sclera. Okay. Now see here, first important thing. Lateral to the pituitary gland, you have here one more structure present here. This is known as cavernous sinus. Okay. So this cavernous sinus, it is in relation to your two veins. Okay. Two veins. Which two veins? These two are your which veins? These are your superior and inferior ophthalmic veins. Superior and inferior ophthalmic veins. They are draining into the dural sinuses. But please remember that the dangerous communication, the double flow is of your superior ophthalmic vein, which is on your lateral side. If this is the medial side, this is the lateral side. So on the lateral side, you have superior ophthalmic vein. It has a double flow. So blood can come here also, blood can go back to there also. It is a dangerous communication. It can, if there is any, you can say danger area of face, any infection, staph aureus can occur through the facial vein, angular veins. It can go into the cavernous sinus, this one, and lead to the cavernous sinus thrombosis also. Okay. So do please remember both these two veins, they are passing through the superior orbital fissure, but they are not passing through the tendinous ring of Zinn. They are staying away or outside the ring of Zinn. Staying outside the ring of Zinn. Okay, 1 point. Clear? Now, this is the one diagram which you must have to remember. Now coming into the second important point. First thing, we must have to know how to remember the actions of these muscles. Then we will come back to the tendinous ring of Zinn, which nerves are passing through, which nerves are leaving outside. So see here, superior rectus muscle raises the cornea upward and medially, depresses the cornea downward and medially, inferior rectus muscle. So we will make one very simple diagram, and that simple diagram will be very easy for you to understand what are the actions of the muscles and how they are going to work it. Okay. So if I draw here, see here, if I draw here the you can say the eye. Okay. So if this is the eyeball, okay, so this is the superior rectus, inferior rectus, this is the medial rectus, this is the lateral rectus. So you can easily tell to me, sir, superior rectus sections, it will cause the elevation of the eyeball. Inferior rectus, it will cause the depression of the eyeball. Medial rectus, it will place the eyeball medially, or it will cause adduction also. And lateral rectus, it will go in this direction, so it will cause what? Abduction of the eyeball. Abduction of the eyeball. If the eyeball is moving in this direction, this is known as intorsion. If it is in this direction, this is known as extorsion. Okay. Now students make here a mistake how to remember all the actions of these muscles. So now we will draw here one diagram. So if you draw this diagram with me, then it will make your life very easy. For example, this is the nose of the patient and this is the eyeball. Okay. Now write here superior rectus. So here you will write inferior rectus. Write here inferior oblique. Write here superior oblique. Okay. Here it will be the medial rectus. Here it will be your lateral rectus. Now see here. These are the directions. So if I am going to ask you what is the action of the superior rectus muscle, so you are going to say, sir, superior rectus muscle, it will elevate the limb, elevate the eyeball also, cornea also, and it will cause what? It will cause the medial or abduction of the eyeball also. Okay, so it will rotate the eyeball medially and upwards. Superior rectus muscle. Now see here, superior rectus muscle. What is the action? Raises the cornea upward and medially. So see here, superior rectus muscle. This is our superior rectus muscle. It raises the cornea upward and medially. Done. Inferior oblique muscle. It raises the cornea upward and it also moves the cornea laterally. Now see here inferior oblique muscle. This is our inferior oblique muscle. Rotate the eyeball so that cornea looks upward and laterally. See here. Cornea looks upward and laterally. So this is how you can make your life easier. One more action you can add here, intorsion and extorsion. So here I will write intorsion. So if I write here intorsion, it means here it will be extortion. इधर मैं इसको उल्टा कर दूंगा. Extortion, opposite, intorsion. So if I am going to ask you what is the action of the superior rectus muscle, so you can say, sir, superior rectus elevates the eyeball upward and medial and also cause intorsion of the eyeball also. Inferior oblique, it raises the eyeball upward and laterally it also causes what? Extorsion also. Okay, so this is how you can easily understand the muscles action of the eyeball. For example, see here, superior oblique muscle. Superior oblique muscle, cornea looks downward and laterally. So see the diagram. Superior oblique muscle. This is our superior oblique muscle. It pushes the cornea downwards and move it laterally. Nose. So if eyeball is going in this direction, it means it laterally it is going. And it also causes intorsion also. So this is how you can understand the actions of the eyeball muscles. कभी भी आपकी, you will never ever going to make a mistake here. Okay, so this is how you can remember it. Clear to everyone? So just remember this diagram. If you remember this diagram, you will never ever going to make mistake. Okay. Now the nerves and their very important thing which you must have to remember in relation to the tendinous ring of the Zinn. So please remember the tendinous, see this diagram. So this is our superior orbital fissure which I am highlighting in red color. This is our superior orbital fissure. Okay, between the lesser wing and greater wing of the sphenoid bone, superior orbital fissure. And this is the tendinous ring of Zinn which I am highlighting in blue color. This is the common tendinous ring of Zinn. Now we must have to know which nerves and structure are inside the ring of Zinn, which are outside the ring of Zinn. At the moment in the diagram, I explained to you two veins are outside the ring of Zinn. superior ophthalmic vein and inferior ophthalmic vein, both are outside the ring of Zinn. Along with these two veins, please remember, three nerves are also outside the ring of Zinn. So outside the ring of Zinn, the structures which are present, the mnemonic is LFT. That is the lacrimal nerve, that is the frontal nerve, and that is the trochlear nerve. Trochlear nerve, fourth cranial nerve, SO4. Okay, so they are outside the ring of Zinn, which are inside the ring of Zinn. Inside the ring of Zinn. See here, third cranial nerve, that is the oculomotor nerve. Oculomotor nerve having two divisions, superior division and inferior division. Then your abducens nerve, that is your which cranial nerve? Sixth cranial nerve, which is innervating your, see here, superior, upper and lower divisions of the oculomotor nerve. See this one, abducens nerve, and one more nerve, that is the nasociliary nerve. Nasociliary nerve. Okay, now you can ask me, sir, ठीक है, okay, third cranial nerve, fourth cranial nerve, sixth cranial nerve, that is LR6, oculomotor nerve. Okay, superior division will going to give to the superior recti muscle. Inferior division, it is going to give innervation of the inferior recti muscles. Okay, so nasociliary nerve, lacrimal, frontal nerve, from where these nerves come. So these all three nerves, they are the branches of your oculomotor nerve. No, oculomotor. Branches of your ophthalmic nerve. Sorry. Ophthalmic nerve is your trigeminal nerve. Trigeminal nerve की तीन branches हैं. First division, that is the ophthalmic nerve. Second division, maxillary nerve. Third division, mandibular nerve. So ophthalmic nerve has giving three branches. Nasociliary branch, which is present inside the ring of Zinn. It is also giving the lacrimal branch and the frontal branch, which are outside the ring of the Zinn. Clear to everyone? So outside the ring of the Zinn, ophthalmic nerve have three branches. This is the ophthalmic nerve branch, this is the ophthalmic nerve branch, and nasociliary nerve, it is also your ophthalmic nerve branch. So we will make here one more diagram. So it will make your life easier. See here, all students. So this is the orbit, this is the orbit. Okay, this is your superior orbital fissure. This is your what? Superior orbital fissure. Now very important point. See here. This is your what? Lesser wing of the sphenoid bone. This is your greater wing of sphenoid bone. Okay. So this is the orbit. Please remember, orbit, it is also forming the floor of your anterior cranial fossa. Okay. Now see here. Here you have the ring of Zinn. Ring of Zinn. Now see here. Here this is your what? This is your cavernous sinus. In the center here your pituitary gland is present. So on one's lateral to the pituitary gland, cavernous sinus here, lateral to the pituitary gland, cavernous sinus is present here. Now we must have to know the nerves. So please remember, see here. This is your midbrain, pons, medulla oblongata. Now see here all students. Third and fourth cranial nerves. This is your third cranial nerve. This is your fourth cranial nerve. Okay. So third cranial nerve and fourth. So this is your, see here. This is your fourth cranial nerve. This one, it is also passing through the cavernous sinus. That is your third cranial nerve. Okay. Third, fourth. Fourth cranial nerve entering into the superior orbital fissure, but it is not passing into the ring of Zinn. This green one, this is the ring of Zinn. This is your what? Ring of Zinn. So it is staying outside the ring of Zinn, and now it is innervating the, your which muscle? Fourth cranial nerve, SO4, superior oblique muscle. Sixth cranial nerve passing through the cavernous sinus. Third cranial nerve passing through the cavernous sinus. And now it is passing through the superior orbital fissure, and now it is giving here two divisions, superior division and inferior division. So this is the inferior division, this is your what? Superior division, innervating the eyeball muscles. Now your sixth cranial nerve, it is coming out from here. Sixth cranial nerve. See, 3, 4 from midbrain, 5, 6, 7, 8. So I will make here. So this is your sixth cranial nerve. Passing through the cavernous sinus, passing through the superior orbital fissure also, passing through the ring of Zinn also, and then innervating to the eyeball muscles. So this is your sixth cranial nerve, abducent, and it is inserting here to the sclera lateral rectus muscle, LR6. Okay, these two divisions are innervating all the rest of the muscles of the eyeball. Okay, eyeball. Okay, so one thing just remember it. Second thing, see here. Here you have your fifth cranial nerve. What is the name of the fifth cranial nerve? That is your trigeminal nerve. Trigeminal nerve. It is making here one ganglion. This is known as trigeminal ganglia. Okay, trigeminal ganglia. Here I will remove this one. Okay, now this trigeminal ganglia, it is giving here three branches. Ophthalmic branch. Okay, maxillary branch, which is passing through foramen rotundum. Mandibular branch, which is passing through foramen ovale. Okay, which is passing through which foramen? Foramen ovale. Foramen ovale here and foramen rotundum here, round. So maxillary nerve passing through foramen rotundum, mandibular nerve, it is passing through foramen ovale. Now this ophthalmic nerve is entering into the superior orbital fissure. But when it enters into the superior orbital fissure, it will divide into three branches. What are the three branches? Number 1, nasociliary nerve. So this one is your nasociliary nerve, which is passing through the ring of Zinn. It's passing through the ring of Zinn. These two branches, they are entering into the superior orbital fissure, but they are not entering into the ring of Zinn. So they are your which nerves? the frontal nerve, and what is the name of the second nerve? Frontal nerve and which nerve? Lacrimal nerve. Okay, so frontal and the lacrimal nerve, they are not the, you can say, not the passing through the ring of Zinn. So LFT nerves outside the ring of Zinn. LFT which one? Frontal, lacrimal, and here the fourth, this one, trochlear nerve. It is outside the ring of Zinn. Frontal nerve, lacrimal nerve, LFT, outside the ring of ring. Third cranial nerve, superior division, inferior division, inside the ring of ring. Sixth cranial nerve, inside the ring of Zinn. Trigeminal nerve, ophthalmic branch, nasociliary nerve, inside the ring of Zinn, and then innervating. So inside the ring of Zing, inside the ring of Zinn, third, sixth, and nasociliary nerve. Okay, so see here. Third cranial nerve, sixth cranial nerve, and the nasociliary nerve. It is present inside the ring of Zinn. Clear to everyone? So these are the important points in relation to the ring of Zinn. I hope it is clear to all of you. Now one last thing in relation to these nerves, you must have to remember one ganglion here. That is known as ciliary ganglion. Please remember ciliary ganglion. It is present, it is, you can say, it is mainly your parasympathetic ganglion, and it is placed in the course of your oculomotor nerve. Very, very important. Okay, it is present near the apex of the orbit, between the optic nerve, present between the optic nerve and the lateral rectus muscle. Okay, and now it is carrying the parasympathetic fibers. So I will make one diagram so it will make your life easier. So see here all students, this is your midbrain. The main nuclei of the oculomotor nerve, it is present in the midbrain. So this is the oculomotor nerve nuclei. Oculomotor nerve nuclei. It is present in the midbrain at the level of superior colliculus, third cranial nerve. Here one more nucleus is present, this one. This nucleus is known as Edinger-Westphal nucleus. WHEST. WEST, sorry. Sorry, 1 second. So this is your Edinger-Westphal nuclei. Okay, so this is the fibers of the Edinger-Westphal nuclei. So this hold together, this is your oculomotor nerve. Oculomotor nerve, that is your third cranial nerve. Now when it is entering here, see here, it is giving here two divisions, superior division, inferior division. Superior division, it is giving innervation to levator, palpebral superior muscle, and superior rectus muscle. Inferior division, inferior rectus, medial rectus, and your inferior oblique muscle. Okay, but along with the inferior division, it is also taking the fibers of the ciliary ganglion. So please remember, the parasympathetic root arises from the nerve to the inferior oblique muscle, to the inferior oblique, or through the inferior division. It contains preganglion. These are your preganglionic fibers. Preganglionic fibers. So preganglionic fibers begin in the Edinger-Westphal nuclei, which is present in the midbrain. And now the fibers are relaying in the ciliary ganglion. So this is your ciliary ganglion. And after the ciliary ganglion, see here, now it is going through these nerves. These are your short ciliary nerves. And now it is going to innervate these two muscles. Number 1, ciliary muscle. Number 2, constrictor pupillae muscle. Okay, so these two muscles through the ciliary ganglion, it is innervating your parasympathetic. So postganglionic fibers arises in the ganglion through, these are your, please remember, these are your postganglionic fibers arise in the ganglion through short ciliary nerves and supply the sphincter, इसको sphincter भी बोल सकते, sphincter pupillae and the ciliary muscles. These muscles are used in accommodation. They are used in accommodation. Okay, so please remember, this is your what? This is your ciliary ganglion. But please remember one more point here, that here also some sympathetic fibers are also going. So what are the sympathetic fibers? These are the parasympathetic fibers. Okay, so this is the parasympathetic fibers to the ciliary muscle and the sphincter pupillae muscle. Okay, the parasympathetic fibers, the sympathetic fibers, these are the parasympathetic, these are your parasympathetic fibers. Because ciliary ganglion, it is your parasympathetic ganglion. See, this is your parasympathetic ganglion. Okay, so the sympathetic fibers to the dilator pupillae, एक और मसल भी है, that is the dilator pupillae. It is through your long ciliary nerves. Okay, long ciliary nerves. So their fibers, sympathetic fibers to the dilator pupillae, which will cause mydriasis. Constrictor pupillae क्या करेगा? Constrict करेगा, so it causes meiosis. Okay, so dilator pupillae, it will cause mydriasis. So it can take the fibers from your T1 sympathetic fibers from your superior cervical ganglion. Superior cervical ganglion, and then it will reaches to the dilator pupillae in the form of your which nerves? Answer will be your long ciliary nerves. Okay, so please remember this ciliary ganglion, it is very, very important. This is your ciliary ganglion. Okay, and if whenever patient is having cranial nerve injury or damage, so please remember these muscles action will be gone, so dilator pupillary action will remain normal. So the patient with cranial nerve 3 damage, for example oculomotor cranial nerve 3 damage, there will be downward and outwards eye, down and out eye. Plus one important thing which you must have to remember, along with down and out eye there will be ptosis, because it is also innervating the levator palpebrae superior. Ptosis, the pupil will become dilated. Pupil will become dilated. Why? Because the sphincter pupillae here, see here, this muscle here, it is not going to work. So this dilator pupillae becomes more active, so there will be pupil dilated. Okay, sphincter pupillae is paralyzed, so it will become dilated pupil. Okay, dilated pupil, eye becomes downward and outwards. Why? Because third cranial nerve is not working, so your opposite 6 and 4 cranial nerves become more, you can say, more powerful. So patient will come to you with ptosis, down and outward eyes, and dilated pupil if it is having cranial nerve 3 lesion. Cranial nerve 3 lesion. If patient is having, see here, if patient is having, see this diagram, if patient lateral rectus muscle is gone, that is the lesion of the sixth cranial nerve, then what happen? Medial rectus become more powerful, so patient will develop what? Patient will develop medial squint. Okay, so when lateral rectus 6 LR6 is not working, so MR3 medial rectus become more powerful, so patient develop what? Medial squint. Okay, medial squint. So these are some of the points which you must have to remember. Okay, if it is a fourth cranial nerve lesion, that is the trochlear nerve, patient will develop vertical diplopia. Okay, so cranial nerve 4 lesion, patient develops vertical diplopia, especially upon reading, especially on going looking downward, and when the patient is going to go downward, so patient what will start to do, they will start to you can say direction, they were going to head tilt to the opposite side. Okay, so you start the head tilt to the opposite side. So 3 lesions you must say, cranial nerve 3 lesion, ptosis, dilated pupils, eye downward and outward. Okay, cranial nerve 6 lesion, there will be what? Medial squint. Okay, and cranial nerve 4 lesion, head tilt to the opposite side of the lesion. Okay, so these are some of the important points. I hope it is clear to all of you. See here, sphincter pupillae of the iris, parasympathetic constricts the pupil, ciliary muscle, parasympathetic via oculomotor nerve. So these two are through your ciliary ganglion. Ciliary ganglion, accommodation and constrict the pupil. So if they, and it is through your Edinger-Westphal nucleus, which is your third cranial nerve nuclei. So third cranial nerve is damaged, there will be no constriction of the pupil, there will be no accommodation, and patient will develop what? Dilated pupil. Okay, so there will be what? Dilated pupil, damage down and outward eye, and there will be ptosis, okay, and downward outward eye. Okay, so these are some of the important points which you must have to remember. I hope it is clear to all of you.